Hello, this is Dr. Patmos again. It is Martin Luther King Day, and this is a follow up video to the one I just did a few minutes ago that provided the best evidence supporting the fact that masks do work in preventing the spread of COVID. I promised you a follow up video on how masks work with respect to severe outcomes, that is, hospitalization and death, which is, after all, the bottom line for everything we do in medicine. My mentor told me, your job as a doctor is don't send them home in a pine box. And so ultimately, the end point that matters is always mortality. And so, what is the evidence? Do masks benefit in severe disease and in mortality? So let's explore that and see what the quality medical literature actually says. I attached a link to a Fox News episode where Dr. Mark Siegel, who's a fine internist but has no training in infectious disease or infection control, opined that masks are essentially worthless and they have no role. Well, unfortunately, for Dr. Siegel, the literature says otherwise. Below is a curated list of best literature filtered through a New England Journal of Medicine's open evidence AI website. What you have is the best evidence, and it's all right below with references, so you can tear into the data and dig into the studies yourselves to see, that the fact that the reality is that although the evidence isn't crystal, perfect, there is good evidence overall. The bulk of the evidence is that masks reduce transmission of disease, reduce infection, and they reduce hospitalization and death. No question, there is definite benefit there. It's not perfect, but it's better than not having any protection at all. And so it gets back to why do these experts on Fox News get it wrong? Well, I think the reason they get it wrong is obviously they have a political bias and they're paid to present a certain point of view, which is supportive of the administration. But I think the larger issue is the fact they don't have the training. If you're not trained in if you're not a fellowship trained infectious disease doctor, you are not an infectious disease doctor. If you're not a fellowship trained infectious disease doctor, you are not an expert in clinical infectious diseases. That is the minimum requirement that you have to have. If you want to be an expert in clinical infectious diseases, you must be a fellowship trained infectious disease doctor. Infection control and hospital epidemiology is a whole nother area of training. It is not a fellowship, it's a separate certification process. I have additional training in infection control, and I can tell you that the things that were recommended during COVID were standard infection control practices that are well established in the medical literature. These doctors who are on Fox are not trained in infection control or infectious diseases. So the likelihood is they're going to get it wrong. Excuse me. If you don't have the right training in in cardiology, you're probably not going to be a very good doctor for taking care of patients with heart attacks. So the bottom line is that in medicine, we have to stick with our training. If you're not trained in something, you shouldn't be opining as an expert. I am an expert in internal medicine and in infection control and hospital epidemiology, and the evidence supporting use of masks in prevention of disease and in severe outcomes is below. The data is right there. You can read it for yourself. These doctors on Fox News are wrong. Sorry to say that, but literature does not support what they are saying. So now let me just let's add one little comment about infection control. You know, nobody likes infection control doctors in the hospital when there are problems, like if there's a problem with Clostridium difficile or now Clostridoides difficile outbreaks in a hospital, or there's an outbreak of anything, any contagious disease in a hospital. Infection control practitioners, nurses, and doctors sweep in and take care of these problems, and we impose rules and regulations such as gowning and gloving and masking and universal precautions and so forth to prevent the spread of disease inside hospitals. And um, it is, kind of burdensome sometimes. And I can tell you that a lot of doctors don't like it when infection control doctors come in and tell them, no, you've got to go down, glove, universal precautions, masks, wash your hands, blah, blah, blah. We have to actually do all kinds of programs just to get people to wash their hands. You would think in this day and age that we wouldn't have to do that, but we do. And administrators oftentimes get mad at infection control because our policies and procedures sometimes add costs. All the gowns and gloves, for example, add up. The masks add up, and sometimes the CFOs, say, "What's all this expense?" The reality is, if you want to prevent infectious diseases, you have to understand infection control. And unless you're trained in infection control, shut up. You're really not an expert at it. None of these doctors are on Fox News are trained in infection control. So anyhow, I thought you might find this interesting, and it stands in sharp contradistinction to the stuff you're being told on social media and Fox News, which is basically a propaganda outlet for the administration. Masks work. The data proves it. It's all right there below. Read it and weep. If you don't like masks, read the below. Tough. They work.